Hey friends, welcome back to the Founder Series. I'm Dr. Rebbecca Hertel, and I'm so glad that you are all here. Today, we're diving into something that every woman in medicine eventually realizes, all these things that we were never taught, which is the business side of what we do. In medical school, we learn how to care for patients, diagnose diseases, and survive intense overnight call. But no one taught us how to read a contract, negotiate a salary, or build a sustainable career that doesn't lead to burnout. We're trained to care for others, but we're not trained to protect our own value. It's the craziest thing, right? And so for many of us, especially women, that missing curriculum is exactly why we're underpaid, why we're overworked, and often feeling like there's no room to build this life that actually fits what we want. So today, we're going to unpack it all. In the Founder's Journal, I'll talk about what it's really like to navigate medicine as a woman, as a mother, and now as an entrepreneur, and how I learned to stop waiting for permission. In the Midlife Minute, we'll look at the mindset shift that every woman in medicine needs to make about money, about worth, and what it means to lead. And in the lab, we'll dig into the research, what the data says about women being paid less, promoted less, and what those numbers tell us about the future of female leadership and patient outcomes in healthcare. So grab your coffee, your notebook, tea, and just take a breath, because this one's about empowerment, business, and rewriting the rules. So let's get into it. So when I finished residency, I thought I knew what success looked like, right? You find a stable job, maybe they're repaying your loans, you get a sign-on bonus, the hours didn't look so bad compared to what residency was. You're going to work really hard. You help people. You're probably even doing some moonlighting, and you get paid for what you think is pretty darn good, especially compared to your residency salary. This was like incredible, right? But what no one tells you in medical training, or even in medicine, in medical school or residency, right, is that the system wasn't designed to make that happen for you, and especially not for women. We weren't taught to negotiate. We were taught to be grateful that we actually found something. And, the fact that we're grateful that we're even in this career for a lot of us, right? We're just still this fairy tale. We were taught to read a contract. We were told, don't worry, this is standard. We weren't taught to get someone to help us look over a contract, right? If this is not what we're taught to do, then perhaps we need to find someone to help us read a contract. We weren't shown the business side of medicine, right? I think we all thought that that really wasn't our job. Like, our job was to help people. Our job was to find a job so that we can start paying back those enormous student loans. So here's what that creates. It creates generations of women physicians working within structures they didn't build and were never meant to lead in. So, I was a mom going into medical school and into residency, and so by the time I was done, at that time I was a single mom, right? So all those gaps were still there. They weren't any different. I need to make sure that the schedule flexibility that I had, I thought at the time was great. I could have a couch in my office for my kids, but those types of things, I think, even in the specialty that I chose, comes with cost of pay or promotions. And is that way, I think, for a lot of women too. So the supportive systems for working parents, I think, are more patchwork together, right? And I think it took a lot of us from this generation to realize that it wasn't us that are broken, that's the model. So when I started to build something different, something that reflected my values in my life, I started my own practice, learned to structure my business, negotiate like a founder, and build a career that actually supports my family and my health. And here's the truth. Medicine is not one lane. You don't have to choose between hospital employed, burnout, or leaving entirely. There are so many models: private practice, telemedicine, consulting, teaching, content creation, research, writing, speaking, even creative entrepreneurship. You can design your own table instead of waiting for someone else to give you a seat. So if you're listening right now, feeling stuck or undervalued, this is your reminder. You don't need permission to own your own career. You just need to start learning the parts of medicine we were never taught. And speaking of what we weren't taught, let's talk about one of the biggest gaps of all: money. because understanding the numbers isn't about greed. It's about equity. When I finished residency and starting a job, I really thought I knew what success looked like, right? I had finished medical school with kids, residency with kids. You got a stable job, you work hard, you help people, you get paid good. Go back. You just don't need to start learning the parts of medicine we were never taught. We need to go back to that. And part of what we weren't taught is just how unstable the current model has become. The Association of American Medical Colleges projects that by 2030, the U.S. will be short between 60,000 and 86,000 physicians. Primary care, OBGYN, and rural fields are already in crisis, and women are leaving faster than any other demographic. Why? Because from the moment training begins, medicine teaches endurance before humanity. The hierarchy starts early, those long hours, the unspoken rule that exhaustion is a badge of honor, right? Like you go in, oh, how many hours did you work? Oh, I was up all night and I need to go back in the morning for clinic for half a day. The belief that vulnerability equals weakness. So hazing isn't the official word, but it is the reality. You learn to tolerate humiliation, to internalize shame, and to normalize being mistreated. The kind of conditioning doesn't disappear when you graduate. It follows you into your first attending job, into every contract you sign, every meeting you sit in, every time you feel you can't speak up. And for women physicians, the impact compounds, right? We enter a profession where only 37% of practicing physicians are female, yet we're paid on average 28% less than our male counterparts. We are more likely to be interrupted during rounds, to have our expertise questioned, and to be penalized for things like maternity leave or flexible scheduling. Guys, I can't tell you how many times I walked in as a med student and as a resident and asked if I was the nurse, even though I had introduced myself as the physician, even though I had the white coat on, even though my badge said who I was. Am I the nurse? No, I'm not the nurse. I'm actually the doctor here to take care of you, right? That's not a personal failing. That's a systemic programming where we were taught to be helpers, not negotiators, to show gratitude, not power. And I think that's why so many brilliant women eventually walk away from clinical medicine, because they can't handle it. Really, you guys, we can handle things, but it's because the model refuses to handle them. But I also believe this is the generation that changes that story. More women are opening private and micro practices, embracing telemedicine, building online education platforms, mentoring differently, and redefining what leadership looks like. We're no longer waiting for the system to make space. It's amazing. We're kind of creating our own ecosystems, one that honors our families if you choose, our patients, and more importantly, our boundaries. It's not a rebellion, though. It's a reclamation, because understanding how medicine works, the business side, the economics, the equity isn't about greed, right? It's about staying in the field without losing yourself. It really is about learning what exactly it is that you want, because we just never knew what was there. So, and speaking of what we weren't taught, let's talk about one of the biggest gaps of all, money, because understanding the numbers isn't about greed. It's about equity. So in the Midlife Minute, let's talk about the pay gap in medicine. And according to multiple large studies, women physicians earn on average $100,000 less per year than men in the same specialties. And that gap starts early, during residency, and widens with time. Why? Is it because men are more likely to negotiate earlier and more often? Yeah, because women's communication, mentoring, and administrative work are often unpaid, because institutions still assume mothers will step back and reward availability instead of value, and because somewhere along the line, we absorb the belief that asking for what we're worth is ungrateful. How many of you feel bad for asking for more or for asking what's fair? But here's the truth. Wealth isn't greed, it's agency. It gives you the power to choose your schedule, to hire help, to invest, to donate, to design your life. Not a bad concept, right? So money in the hands of women changes everything. It can stabilize families. It improves communications and communities, builds generational change. So we have to start teaching women physicians how to read contracts, how to create multiple income streams, how to invest early, and how to ask questions like, can you walk me through how you calculated that compensation? I don't think I've ever asked that question ever. That one sentence can change the entire tone of a negotiation. And for my fellow clinicians and fellow moms, your time has value. The flexibility you create for your family has value. And you don't owe anyone an apology for designing your career around your life. It keeps us in the game longer when we're happy, right? Makes sense. We're not burnt out. We don't have to choose. When women in medicine start owning their financial literacy, the entire system shifts. All right, you guys, let's head into the lab because the numbers tell a story and understanding them is how we start to change the system. So in the lab, let's actually look at what the data actually shows. Number one, the pay gap is real and it's persistent. And the 2025 Doximity Physician Compensation Report shows that in 2024, the gender pay gap among US physicians has returned to 26%. So women earned on average $917,000 less than their male peers, even adjusting for specialty, location, and years of experience. In that same year, compensation for men rose 5.7%, while women's grew just 1.7%, widening the gap yet again. So over a full career, that compounds, right? One analysis found that male physicians adjusted gross income exceeds females by over 2 million, which is roughly 24.6%. When simulating a 40-year career, this isn't about working fewer hours, you guys. This is like structural underevaluation. So for midlife physicians, especially, right? Those often juggling aging parents, teen children, maybe young children, menopause symptoms, sometimes part-time work or job transitions, that gap isn't just financial. It does erode the capacity to invest in your own health, to scale your clinic, to afford the safety net for slower years, and for patients in midlife and longevity care. Many are seeking doctors who get them, but resources feel limited. These patients often want continuity, deep care, holistic approaches, and increasingly they're turning toward concierge or boutique practices because those traditional systems feel too fragmented or dismissive. Yet fewer clinicians are able to step into those models under traditional compensation constraints. Number two, the promotion problem. Oh, goodness. So women now represent a majority of medical school graduates and close to half of academic faculty. Yet they hold only about 25% of department chairs and 27% of medical school deans. Even when matched for publications, experience, and specialty, women progress more slowly to full professor. Why is that? Promotion sciences still reward metrics like grant volume, big ticket research, productivity, and rugged individualism. Then undervaluing mentorship and teaching, patient communication, and relational leadership. It's crazy. Honestly, when I was doing all the research for this, I think my mouth was just like, right? Number three, how about leadership and the future of medicine? When institutions, transparent pay scales, equitable promotion criteria, childcare support, sponsorship, not just mentorship, and leadership training, they retain more diverse physicians and outperform their peers. And interesting, when women lead, the ripple effect is powerful. You get better care models, more inclusive workplaces, and higher institutional trust. How about patient outcomes? So the data speaks. This isn't just about fairness. It really is about lives. A landmark JAMA internal medicine hospitalist study showed that elderly hospitalized patients treated by female internists had lower 30-day mortality, 11.07% versus 11.49%, and lower 30-day readmission rates, 15.02% versus 15.57%, compared to those treated by male internists. Interesting. Another large Medicare cohort analysis revealed that female patients treated by female physicians had a mortality rate of 8.15% compared to 8.38% when treated by male doctors. Even for male patients, there was a slight advantage, 10.15% versus 10.23% mortality when cared for by female versus male physicians. That was through UCLA Health. These differences persist across disease severity, suggesting then a difference in practice style, a difference in communication, vigilance, and holistic care. So the stakes are high when women in medicine are undervalued, underpromoted, and underpaid. The system's deficit rippled down toward the patients. Next, the call to action for all of us. We must push for structural change, but that doesn't mean waiting passively. Transparency in compensation and contract terms is definitely not negotiable. And we really need to be teaching our students how to read contracts, the business side of medicine, sponsorship over mentorship, having someone actively open doors for you. And like I just said, business literacy needs to be baked into medical education. Between this and midlife menopause care are like two main things: contracts, billing, negotiation, scaling care. Because when midlife physicians understand their worth and their leverage, everyone wins. Better retention of seasoned clinicians, more thoughtful care for patients navigating complex bodies and lives, and an ecosystem where midlife and longevity medicine becomes accessible. Understanding the business side of medicine isn't selling out, it's showing up, right? It's really important. And it's particularly important, again, for our med students and our residents coming out, knowing that they have multiple options, not just feeling that they have to, become an employed physician. They don't have to, but they can if they want to. And then negotiating these contracts, negotiating their stipends, their, RVU scales, their tuition reimbursements, their 401, their benefits, all of these things. Because when women in medicine understand their worth, then everyone wins. And that truly is what is the most important, right? All right. So let's wrap this up. Today in the Founders Journal, I shared what it's like to navigate medicine as a woman, as a mom, and entrepreneur. In the Midlife Minute, we talked about the mindset shift that turns money into agency. And then in the lab, we looked at the data, right? The real numbers on pay, on promotion, and why female leadership isn't just good for equity, it's good for medicine. So here's my takeaway. Understanding business doesn't make you less compassionate. It makes you capable. You can be both a healer and a leader. You can be both nurturing and powerful. It's time we stop playing small and start learning the parts of medicine that allow us to lead, that allow us to learn, that allow us to earn and live differently. So go negotiate that contract and ask those hard questions. Build your own model if you need to. And remember, you are the founder of your own life. So if you love this conversation, don't forget to rate, subscribe, and leave a review. It helps more women find the show and join the midlife movement. You can connect with me and explore more resources through the newsletter, Substack. On Substack, for deeper dives, updates, and reflections, you can follow me on YouTube, where I share full episodes, Midlife Minutes, clips, and expert insights. On Spotify, the Founder Series, you can listen on the go anytime. You can find me on LinkedIn, and you can find me on Instagram as well for daily insights, education, and behind the scenes, also on TikTok as well. Also, don't forget that if you listen to this through the Pinnacle app, you can earn CME credit for listening. If you follow me through Facebook, you can follow for community updates and educational lives. And if you're ready for personalized midlife care or want answers about hormones, weight, and well-being, book a consultation at osteopathicmidlifehealth.com. You deserve to feel vibrant, grounded, and strong in this chapter, and I'd be honored to help you get there. So until next time, I'm Dr. Rebbecca Hertel, and we're navigating midlife and medicine together.